Hi, my name is Jonathan McLean, and I'm the founder and CEO of McLean Aesthetics.
Welcome to the dark side.
Let's go! Hey Ryan, how are you?
I'm well, Jonathan. How are you?
Good. Now Ryan, tell the audience actually, where are you originally from?
So I'm originally from North Jersey, Bergen County, New Jersey. And I went to PA school in Manhattan at the CUNY School of Medicine Harlem PA program in Harlem. And I went right into plastic surgery. I worked in Midtown Manhattan for a plastic surgeon before moving down here to South Florida last October 2021. So I'm officially been down here a year now today.
Super cool.
Yeah.
How hard, tell me about how hard was it to get into aesthetics?
It was difficult, but I was very aggressive. I had you helping me as a recruiter. I cold called every plastic surgeon and med spa in Midtown Manhattan and I told them that I'm like a young PA that wants to get into plastics and aesthetics. I got a few interviews that way, and it just worked out. Just getting my foot in the door really just helped push me to be who I am today. So yeah.
Yeah, no, I will say that when I first met you, you were super. I wish every candidate that I meet could be like that.
Oh,
Because, yeah, you really wanted it and you got in.
Yeah.
You pursued it anyway. You sent your resume out, you made your calls yourself,
yeah.
and you eventually found opportunity.
Yeah.
What advice would you give to new injectors looking to enter the field?
I would say definitely just be yourself, but be assertive, and just be wanting to grow and learn every single day. Every training, every video. I'm constantly watching YouTube videos, TikToks, everything of injectors and learning new techniques. So just be aggressive with wanting to learn and push yourself into the aesthetics world. That's probably the advice I would give to new injectors. Yeah.
Yeah, for sure.
Yeah.
Being from, working in New York and coming to South Florida, what are some differences that you see in the aesthetic industry?
Well, I also speak Spanish, so
Nice.
living down here in South Florida, that's really helpful. We have a lot of Spanish speakers here, so that definitely helps. Clientele is different here. It's a little more laid back and chill compared to the Manhattanite, uptight woman there. But I would say that people here are more chill, relaxed, willing to take my advice on their aesthetics and don't have kind of the preset, intentions that some New Yorkers have, patients coming in for aesthetic services, I guess. Yeah.
That's very interesting that you say that.
Yeah, yeah.
Because like a lot of injectors say like in South Florida is very big and everybody wants to be noticeable with it, and then New York is very like hush hush.
I mean, I guess it depends,
Yeah.
right? I mean, there definitely is like the Florida, the Miami look, right? Like
Yeah.
the overfilled cheeks and lips, but I'm totally against that. I'm very into the natural look. So there are patients that I do sometimes have to turn away because they are very overfilled
Yeah.
and they want to be filled more. And I'm like, no, you represent me and the med spa that I work at. So, but everybody's different. Everybody's anatomy is different. Everyone has different expectations. It's just important to set the patient's expectations so that they're realistic.
So many things you just said is a good point. I want to definitely talk about it more. What trends are you seeing right now? Like, what are your patients coming next for the most right now?
Well, right now, probably the biggest thing that I'm doing is the scrotox, which is the Botox into the scrotum, which helps the scrotum hang lower, sweat less. So it's aesthetic and medical use there. So that's probably the thing of the past month that I've been doing. But we also offer here at Profile, sexual wellness packages. We do the P shot, which is the PRP injected into the shaft of the penis to help with erection and libido, the shockwave therapy. So a lot of the sexual wellness things, I would say, are really the it thing right now.
Yeah.
Yeah.
Who could benefit from that, or is there anybody that can't benefit from that, or you won't be a good candidate for that?
So basically, almost anyone can benefit from it, right? If they have any trouble with erections, with libido, with maintaining an erection, definitely the P shot and the shockwave can help with that. The scrotox is more of a niche thing, right? If they want the appearance of the testicles to hang lower, sweat less, that's more of that type of thing, a niche. And then we also do the hormone replacement therapy, which is bioidentical hormone replacement. So it's the same as our testosterone, and it's actually vegan. It's synthesized from the Mexican yam.
Wow.
And we take your blood and we test your testosterone levels to make sure you're a good candidate. And then we insert the pellets into the gluteal area, and that lasts between 4 to 6 months, a sustained release of testosterone, which helps them build muscle, reduce fat, and the same thing with increase libido, increase erections, and all of that stuff. So it's a great procedure that I do as well here.
Wow, super cool. Very, very super cool stuff.
Yeah.
I'm assuming that required a lot of training. Like, how did you,
Yes.
tell me a little bit about that?
Yes. So we actually work with a company called Pellicomb. So I watched over, I think, 20 hours of training videos, and then we had an in-person training here as well with a doctor who is up in North Florida. And but it's a pretty simple procedure. Me having experience in the operating room in New York, this is like kind of a piece of cake to me. Just an incision, put in the trocar, insert the pellets, and it's really painless for the patient, which is amazing. It's important to me to make sure they're numbed and comfortable during the procedure. And yeah, so I'm a pretty quick learner, and as long as my patients are comfortable and happy, that's all that matters. So yeah.
Now, I know sexual wellness is a very sensitive area. It's a very sensitive topic. How did you feel like I was comfortable enough or confident enough to be like, I don't want to mess up with anybody. I'm good,
Yeah. I mean, it's definitely, some people feel uncomfortable talking about it, but just making the patient know that they're in a safe space and that there's no judgments happening, right? We have a wide range of patients in their 20s, patients in their 80s, right? So everybody has different sexual health journey. But we're here to support men in every stage of their life, basically,
Awesome.
Yeah.
Now, as far as the community with injectors right here in the South Florida area, is it important to know different injectors and I guess build that community, or tell me a little bit about that?
Definitely. I mean, I have a lot of friends that I've made over the past year since moving to South Florida in the injector community. Most of them are women. So, just being a young male injector, there aren't too many of us, at least down here in South Florida. But definitely learning from each other. If I ever have a question, I can always DM, a fellow injector, and they'll always help out. And I think that being part of the injector community and just helping each other grow and learn is really important. Some people are competitive, but I view it as always wanting to help people grow and people helping me grow too in the community here. So yeah, so it's pretty awesome.
And I think that's the biggest thing, right? You put out what you get in, right?
Exactly.
You learned all that information, give it to someone else that you want to get, right?
Right.
Build that up, because then you might need it later on. You might need someone else later on, for sure.
Exactly. Definitely.
Now, it's a new drug in the market, Daxxify. Have you heard of it? The Botox?
Is this the topical?
No, the Daxxify.
No, I haven't. Someone mentioned this to me, but I'm like so crazy. I haven't looked into it yet. But
yeah. How do you feel about, I guess, they're expanding with products and new things all the time. How do you feel about that?
I think it's great. I think that, having new neuromodulators, new dermal fillers are amazing. And I love to try all of the new stuff.
Yeah.
I obviously have my personal preferences, also depending on the patient's age and gender and their anatomy, right? Certain products I prefer over one another. But yeah, I'd be willing to try Daxxify. I know that Jeuveau was one of the newest toxins, which I never actually personally tried. I work a lot with Botox, Dysport, Xeomin sometimes, and then, the Restylane and Juvederm filler line, as well as Versa and Radius.
Nice.
But yeah, I'm definitely willing to try new neuromodulators and see what works best for people. It's
super cool.
Yeah.
Now, social media has been a mega thing for injectors, even for myself. First thing I tell providers when they're looking to enter this industry, build an Instagram and display your work.
Yeah.
Tell me how social media has increased your career or has it impacted your career?
It definitely has. I mean, I do have a professional Instagram. I do need to post more on there. I'm always working, so editing the before and after photos and posting them is a lot of work as well in my free time. But I think just working at the med spas that I work at now, Profile and James Christian, and being kind of up on their Instagram, talking about, services that I do, showing me actually doing the service, I think is so beneficial, because when the patient sees the provider actually performing the service, making the patient so comfortable, the patient so happy afterwards, they can kind of see themselves in that patient and see themselves in my chair, and that helps bring them in the door, which is the most important part.
Yeah.
So social media definitely fuels that the most. So it's extremely important to have that social media presence as an injector.
Because you're displaying, like you just said, you're displaying your personal brand. People know what to
Exactly.
expect when they come see you.
Right, exactly. Like even today, the first patient that walked in was like, "Oh my God, you're real! I see you on Instagram." I'm like, you know, like it just helps them be more comfortable to come in. They know, you know, what I'm like, my style before they even meet me. So I think that that's one of the big benefits too of social media presence.
Yeah, that's super cool. Building that, and we call it the Instagram effect.
Right, definitely.
The like effect.
Yeah,
for sure.
and TikTok as well is important too.
Yeah, how do you feel as a provider? Because I know some providers are like, I went to medical school, I've been doing this for so long, I'm not going to be on Instagram, I'm not going to do the TikTok dances.
Right, yeah.
Tell me about that.
I mean, I'm still like a millennial, so I'm into social media, but the Gen Zs are more like the TikTok dancers and stuff. But I think it's fun also to show your patients that you're not just a serious person that is, you know, just doing Botox and filler. Like we also have our own personality, and I think showing that to patients is helpful as well. We've done some doing, you know, the TikTok dance challenges and stuff. We did the Rosalia like stank face challenge here at Profile, and that was one of our most viewed videos and videos too.
Yeah.
So, you know, it just brings a little humor, which kind of helps draw even more patients in as well. So I like that about that aspect.
Yeah, because it's almost like you're a personal brand, right?
Right.
And you have to kind of build that up too. Like the aesthetic industry is not kind of like hospital medicine, right?
Completely different.
You go in, you clock out.
Right.
This is so different. How big is it to kind of build that personal brand, and kind of what have you done to kind of build your brand?
I mean, through social media, you know, it's definitely, I kind of speak of injectors as, yes, we are healthcare providers, but it's kind of like going to your barber that you know and that you trust and love, your, you know, your hairstylist, your nail tech, right? We are injecting them with Botox and filler, but once we learn their anatomy and we gain, you know, the patient's trust, they only want to come to see the provider that they trust, you know what I mean? So I think that that's also really important too. So just social media to bring them in the door, learning their anatomy, gaining the patient's trust, and then, you know, they stick with you for life basically. And that's a really important aspect.
Yeah, that patient retention, you're definitely right.
Exactly. Yeah.
Awesome. What do you do to kind of give that white glove service?
I mean,
to retain your patients.
Yeah, I mean, definitely creating a personal bond with your patient, right? So, you know, I'm pretty good with names and faces and remembering things, but even putting into the soap note, you know, patient has 2-year-old daughter that's starting preschool, you know, then when they come back for their 4-month visit to get talks again, ask them about, you know, their daughter, how was preschool? You know, patients really, it brings joy to them to know that you remember little personal things, right? So that definitely helps with patient retention. And just, you know, reviewing the chart and saying, oh, you needed to come in for a touch-up over this brow, so now we're going to do a little bit more this time, just so that you won't have to come in for the touch-up. Really, you know, makes the patient appreciate you as well. You know, just learning their anatomy, connecting with them on a personal level. I would say that definitely helps boost patient retention too.
For sure.
Happier. Yeah.
Awesome. If you could give somebody coming from like the emergency room or maybe like the ER, what would be some cons or some benefits working in this industry?
Definitely the fast pace, you know, of the ER and stuff helps when you're really busy on a day when you literally have 4 patients in the waiting room, you're doing Botox, you're doing filler, you're doing PRP, in and out. It definitely helps you, you know, maintain your patient flow. And, you know, just, the high stress environment or being in the OR, going from the OR to injectables, you know, also was helpful too, because I know, you know, sterile technique, you know, how to make the patient comfortable, how to numb them, how long to numb them for, so that definitely helps as well. But I really encourage anybody who wants to get into the aesthetics industry and is in another field, definitely just go for it, especially if you have the drive and the personality for it. You know?
Nice.
Yeah.
What is one highlight of your career so far that you're most proud of?
I think, you know, people think of aesthetics as like, oh, it's a cash industry, you know, you're only in it for, you know, making money. But no, I'm literally changing people's lives every day because I'm showing, you know, their inner self projected through their outer image. And I had a patient here at Profile, you know, an older gentleman who had a lot of mid-face volume loss, was very, you know, depressed over this, went to plastic surgeons. They were like, you need a facelift, you need a facelift. He was scared. And I comforted him and told him, you know, we can do dermal fillers and give you that youthful result. And he was hesitant at first, but we connected on a personal level, and I did, you know, multiple syringes in his mid cheeks. And when I handed him the mirror, he teared up and cried and was like, this is what I've wanted for so long, and hugged me. And, you know, I'm helping people, yes, externally, but also internally love themselves and project their happiness through their image. So I think that, you know, in that sense, it's so rewarding, like helping people, you know, be their true selves.
I think that's the biggest thing too.
Yeah.
There's different age stages, I like to say, like the young millennials and the older and things like that. But
right.
no matter what stage in life you're going through, you can help to improve whatever that you feel is lacking.
Exactly right. Yeah. So that's definitely rewarding.
Awesome.
Yeah.
Now, I always like to talk about education. Education is huge. What are some conferences or some trainings that you would suggest for new injectors or even experienced injectors to take?
Yeah. I mean, I definitely take advantage of anything through Allergan, through Galderma. I went to like the Prolenium Versa events, you know, going to conferences just to connect with other injectors, meet other injectors, and then see live trainings. Going to, you know, I was at the Miami Beach Convention Center for the Aesthetics conference a few months ago, and we had, you know, Shino Bay was there injecting and all of this, and just kind of learning new techniques is really important. And then there are paid, you know, services that you can go to as well. So if you have, you know, the means to do that, there are definitely some great ones out there, but definitely take advantage of your, you know, local Allergan and Galderma reps trainings as well. Doing hands-on one-on-one trainings at your med spa is really important too. There are some amazing trainers that like I am so indebted to because they've taught me like basically almost everything I know, you know, doing the one-on-one trainings. So
do you feel like the reps are kind of like essential to your career?
Oh my god, definitely. Yeah. So essential to my career. Like just having the reps there for support, and you know, if anything ever goes wrong, like let's say a syringe plunger, you know, is defective, you just text them, send them the lot number, they send you a replacement syringe, you know, and just having them stop in and updating us about like new products coming out, you know, new FDA approvals for certain products is really helpful. But yeah, reps definitely help us a lot. So yeah.
That's good. That's good. Now, as far as social media is concerned, is there anybody on social media that people can follow that you suggest? Or a good example, they show a lot of stuff, content that can help you out as a provider?
I mean, there's so many great injectors. I can't really think of anybody that comes to mind right now that I know, but just I follow so many injectors. Like I'm just like, oh my god, amazing work. Follow, right? And then just posting and learning from each other is just super amazing. So yeah.
What about some of the trainers that you train with?
You want me to name drop? I've trained with Dr. Stacy Chimento.
Okay, perfect.
She's amazing. I don't know if you know her. She's down in Miami. She's an amazing dermatologist. She's done a lot of trainings with me through both Galderma and Allergan. I've trained with Ilanit. She's a PA. She's like super great at lip technique. I've met Julie Horn, so I've like, you know, done training through her amazing, you know, famous Julie Horn lip technique. So many people, but those are some of the ones that really helped me a lot, and I'm really grateful for them. So,
amazing.
Yeah.
Well, thank you so much for sitting down with me and speaking more about the industry. Tell everybody where they can find you and what you have planned next.
Yeah, so my name's Ryan Accardo. I'm a PA, and I'm currently working here at Profile Aesthetics and Wellness in Wilton Manors, Florida. And I work at James Christian Cosmetics in Miami Beach and Sunset Harbor. So come find me at those offices, and I would love to treat you.
All right, thanks, and until next time, bye.
Bye.